Hi, everyone. This is Nurse Anna from nursestudy.net, and we have 75 questions on basic care and comfort nursing NCLEX. If you want to see any more subjects, pathophysiology, or systems questions, please put them in the comments below. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A 68-year-old male patient with chronic obstructive pulmonary disease, COPD, is experiencing increased shortness of breath and requires supplemental oxygen. Which of the following is the most appropriate initial nursing intervention? A. Administer bronchodilators as prescribed. B. Increase the oxygen flow rate to 6 liters per minute. C. Position the patient in a high Fowler's position. D. Encourage the patient to perform deep breathing exercises. Answer. C. Position the patient in a high Fowler's position. Rationale: positioning the patient in a high Fowler's position helps to improve lung expansion and facilitates breathing. Administering bronchodilators, increasing the oxygen flow rate, and encouraging deep breathing exercises are also important interventions but should follow after ensuring the patient is in an optimal position for breathing. Question 2. A patient with diabetes mellitus is experiencing symptoms of hypoglycemia. Which of the following signs and symptoms would the nurse expect to find in this patient? A. Polyuria and dry skin. B. Tachycardia and diaphoresis. C. Fruity breath odor and Kussmaul respirations. D. Increased thirst and blurred vision. Answer. B. Tachycardia and diaphoresis. Rationale: symptoms of hypoglycemia include tachycardia, diaphoresis, shakiness, confusion, and irritability. Polyuria and dry skin, fruity breath odor, Kussmaul respirations, increased thirst, and blurred vision are associated with hyperglycemia. Question 3. A patient with congestive heart failure, CHF, is admitted with severe dyspnea and peripheral edema. The nurse anticipates which of the following interventions will be ordered to relieve the patient's symptoms. A. Administering a beta blocker. B. Administering a loop diuretic. C. Encouraging increased fluid intake. D. Placing the patient in a supine position. Answer. B. Administering a loop diuretic. Rationale: loop diuretics such as furosemide help to reduce fluid overload in patients with CHF, thereby relieving dyspnea and peripheral edema. Beta blockers are used for long-term management of CHF, but are not the first line of treatment in acute decompensation. Increasing fluid intake and placing the patient in a supine position would worsen the symptoms. Question 4. A 45-year-old female patient is recovering from a total knee replacement surgery. Which of the following actions should the nurse prioritize to prevent postoperative complications? A. Administering prophylactic antibiotics. B. Encouraging early ambulation. C. Providing a high-protein diet. D. Applying ice packs to the surgical site. Answer. B. Encouraging early ambulation. Rationale: early ambulation helps prevent complications such as deep vein thrombosis, DVT, pulmonary embolism, and muscle atrophy. While administering prophylactic antibiotics, providing a high-protein diet, and applying ice packs are important, early ambulation is the priority for preventing postoperative complications. Question 5. A nurse is caring for a patient with a stage 3 pressure ulcer on the sacrum. Which of the following interventions is most appropriate for this type of wound? A. Applying a dry, sterile dressing. B. Debriding the wound with enzymatic agents. C. Cleaning the wound with hydrogen peroxide. D. Using adhesive bandages to cover the wound. Answer. B. Debriding the wound with enzymatic agents. Rationale: Debriding the wound with enzymatic agents helps to remove necrotic tissue and promote healing. A dry, sterile dressing and adhesive bandages are not suitable for stage 3 pressure ulcers, and hydrogen peroxide can be cytotoxic to healthy tissue. Question 6. A nurse is assessing a patient who reports severe, constant abdominal pain and a history of peptic ulcer disease. The patient is pale, diaphoretic, and hypotensive. What is the nurse's priority action? A. Administering an antacid. B. Preparing the patient for endoscopy. C. Obtaining a complete blood count. D. Notifying the healthcare provider immediately. Answer: D. Notifying the healthcare provider immediately. Rationale: the patient's symptoms suggest a possible perforation or hemorrhage, which are medical emergencies. The nurse should notify the healthcare provider immediately. Administering an antacid, preparing for endoscopy, and obtaining a complete blood count are important but secondary to stabilizing the patient. Question 7. A patient with chronic renal failure is receiving hemodialysis. The nurse notes that the patient has gained 5 pounds since the last dialysis session. Which of the following is the most appropriate nursing action? A. Restricting fluid intake. B. Administering a diuretic. C. Increasing protein intake. D. Assessing for signs of fluid overload. Answer: D. Assessing for signs of fluid overload. Rationale: the nurse should first assess for signs of fluid overload, such as edema, shortness of breath, and hypertension. Restricting fluid intake and adjusting diet may be necessary, but immediate assessment is crucial. Administering a diuretic is not appropriate as the patient is on hemodialysis. Question 8. A nurse is educating a patient with rheumatoid arthritis about managing joint stiffness. Which of the following statements indicates that the patient understands the instructions? A. I should avoid any physical activity to prevent pain. B. Applying heat can help reduce morning stiffness. C. Cold therapy is more effective than heat for stiffness. D. It's best to rest the joints and avoid any exercise. Question 8. Answer: B. Applying heat can help reduce morning stiffness. Rationale: heat therapy can help reduce joint stiffness and improve mobility, especially in the morning. Physical activity and exercise are important for maintaining joint function, so avoiding all activity is not recommended. Cold therapy is typically used for reducing inflammation and pain. Question 9. A patient with osteoporosis is admitted for a hip fracture. The nurse should prioritize which of the following interventions to prevent further complications? A. Encouraging a high calcium diet. B. Administering vitamin D supplements. C. Ensuring safe environment to prevent falls. D. Providing weight-bearing exercises. Answer: C. Ensuring a safe environment to prevent falls. Rationale: preventing falls is crucial for patients with osteoporosis, as they are at high risk for fractures. Encouraging a high-calcium diet, administering vitamin D supplements, and providing weight-bearing exercises are important for long-term management, but preventing further injury takes priority in the hospital setting. Question 10. A patient with advanced Alzheimer's disease is unable to feed themselves. What is the most appropriate nursing intervention to ensure the patient receives adequate nutrition? A. Inserting a nasogastric tube. B. Offering pureed food and assisting with feeding. C. Encouraging the patient to eat independently. D. Administering parenteral nutrition. Answer: B. Offering pureed food and assisting with feeding. Rationale: offering pureed food and assisting with feeding helps ensure the patient receives adequate nutrition while maintaining some level of normalcy. Inserting a nasogastric tube and administering parenteral nutrition are more invasive and should be considered only if other methods fail. Encouraging the patient to eat independently may not be effective due to their condition. Question 11. A 30-year-old female patient with newly diagnosed multiple sclerosis, MS, is experiencing severe fatigue. Which of the following recommendations should the nurse provide to help manage the patient's fatigue? A. Taking frequent naps throughout the day. B. Engaging in regular physical exercise. C. Increasing daily caffeine intake. D. Limiting all physical activities. Answer. B. Engaging in regular physical exercise. Rationale: regular physical exercise can help manage fatigue in patients with MS by improving overall energy levels and physical conditioning. Taking frequent naps and limiting physical activities may lead to further deconditioning. Increasing caffeine intake is not a recommended strategy for managing fatigue in MS. Question 12. A patient with a history of chronic pain is admitted for an exacerbation of their condition. Which of the following non-pharmacological interventions should the nurse prioritize to help manage the patient's pain? A. Administering hot and cold therapy. B. Providing distraction techniques such as music therapy. C. Offering relaxation and guided imagery exercises. D. Ensuring a comfortable and quiet environment. Answer. C. Offering relaxation and guided imagery exercises. Rationale: relaxation and guided imagery exercises can help reduce pain perception and promote relaxation. Administering hot and cold therapy, providing distraction techniques, and ensuring a comfortable environment are also important, but guided imagery and relaxation have a more direct impact on pain management. Question 13. A patient with Parkinson's disease is experiencing difficulty swallowing. What is the most appropriate nursing intervention to reduce the risk of aspiration? A. Offering large meals with a variety of textures. B. Encouraging the patient to eat quickly. C. Positioning the patient upright during meals. D. Providing thin liquids to make swallowing easier. Answer. C. Positioning the patient upright during meals. Rationale: positioning the patient upright during meals helps reduce the risk of aspiration by facilitating the proper passage of food and liquids. Offering large meals, encouraging rapid eating, and providing thin liquids increase the risk of aspiration in patients with dysphagia. Question 14. A nurse is caring for a postoperative patient who is at risk for developing a deep vein thrombosis, DVT. Which of the following is the most effective nursing intervention to prevent DVT? A. Applying warm compresses to the legs. B. Encouraging frequent ambulation. C. Massaging the patient's legs regularly. D. Restricting fluid intake. Answer. B. Encouraging frequent ambulation. Rationale: frequent ambulation promotes blood circulation and reduces the risk of DVT. Applying warm compresses, massaging the legs, and restricting fluid intake are not effective measures for preventing DVT and can even be harmful. Question 15. A patient with amyotrophic lateral sclerosis, ALS, is experiencing difficulty communicating due to muscle weakness. Which of the following interventions should the nurse prioritize? A. Providing a communication board or electronic device. B. Encouraging the patient to speak more slowly. C. Offering speech therapy sessions. D. Using written notes for all communication. Answer. A. Providing a communication board or electronic device. Rationale: a communication board or electronic device can help the patient communicate effectively despite muscle weakness. Encouraging slower speech and offering speech therapy may be beneficial, but an immediate solution like a communication board is more practical. Written notes can be useful, but are not as efficient as a communication board. Question 16. A patient with advanced chronic obstructive pulmonary disease, COPD, is experiencing difficulty eating due to dyspnea. What is the most appropriate nursing intervention to ensure the patient receives adequate nutrition? A. Providing small, frequent meals. B. Encouraging high-calorie snacks between meals. C. Administering enteral nutrition. D. Increasing fluid intake during meals. Answer: A. Providing small, frequent meals. Rationale: small, frequent meals can help patients with COPD manage their dyspnea while ensuring they receive adequate nutrition. High-calorie snacks and increasing fluid intake during meals may also be helpful, but small, frequent meals are the priority. Administering enteral nutrition is more invasive and should be considered if other methods fail. Question 17. A patient with end-stage renal disease is on a fluid restriction. Which of the following strategies should the nurse implement to help the patient adhere to the fluid restriction? A. Encouraging the patient to drink fluids freely. B. Offering ice chips instead of liquids. C. Allowing the patient to drink fluids with meals only. D. Providing a list of high-fluid foods to avoid. Answer: B. Offering ice chips instead of liquids. Rationale: offering ice chips can help satisfy the patient's thirst without exceeding the fluid restriction. Allowing fluids freely or only with meals may lead to excessive fluid intake. Providing a list of high-fluid foods is important but does not directly help manage fluid intake, like offering ice chips. Question 18. A patient with a spinal cord injury at the level of T6 is at risk for autonomic dysreflexia. Which of the following symptoms should the nurse recognize as indicative of this condition? A. Bradycardia and hypotension. B. Severe headache and hypertension. C. Muscle spasticity and fever. D. Flushing and hyperthermia. Answer: B. Severe headache and hypertension. Rationale: autonomic dysreflexia is characterized by severe headache, hypertension, bradycardia, and flushing above the level of injury. Recognizing these symptoms promptly is crucial for preventing complications. Question 19. A patient with a tracheostomy tube is experiencing difficulty clearing secretions. Which of the following is the most appropriate nursing intervention? A. Increasing the patient's oral fluid intake. B. Performing tracheal suctioning as needed. C. Encouraging deep breathing exercises. D. Administering expectorants. Answer: B. Performing tracheal suctioning as needed. Rationale: tracheal suctioning helps to clear secretions and maintain airway patency in patients with a tracheostomy. Increasing fluid intake, encouraging deep breathing exercises, and administering expectorants can help but are secondary to immediate suctioning. Question 20. A nurse is providing discharge teaching to a patient with newly diagnosed celiac disease. Which of the following dietary instructions should the nurse include? A. Avoid foods containing dairy products. B. Include whole grains and fiber-rich foods. C. Avoid foods containing gluten. D. Increase intake of high-protein foods. Answer: C. Avoid foods containing gluten. Rationale: patients with celiac disease must avoid foods containing gluten to prevent symptoms and complications. Dairy products, whole grains, and high-protein foods are not specifically related to celiac disease management. Question 21. A patient with chronic back pain is prescribed a transcutaneous electrical nerve stimulation, TENS, unit. Which of the following instructions should the nurse provide regarding the use of the TENS unit? A. Apply the electrodes directly over the spine. B. Use the TENS unit continuously throughout the day. C. Adjust the intensity to a comfortable level. D. Apply heat while using the TENS unit. Answer. C. Adjust the intensity to a comfortable level. Rationale: the patient should adjust the intensity of the TENS unit to a comfortable level for effective pain relief. The electrodes should not be applied directly over the spine, and continuous use is not recommended. Heat should not be applied while using the TENS unit. Question 22. A patient with rheumatoid arthritis is experiencing a flare-up of joint pain and swelling. Which of the following non-pharmacological interventions should the nurse prioritize? A. Encouraging passive range of motion exercises. B. Applying heat and cold therapy. C. Promoting rest and joint immobilization. D. Offering a high-protein diet. Answer. B. Applying heat and cold therapy. Rationale: heat and cold therapy can help reduce pain and swelling during a flare-up. Encouraging passive range of motion exercises, promoting rest, and offering a high-protein diet are important but secondary to immediate pain and swelling management. Question 23. A nurse is caring for a patient with cirrhosis who is experiencing ascites. Which of the following interventions is most appropriate to help manage the patient's condition? A. Administering a diuretic as prescribed. B. Encouraging a high-sodium diet. C. Providing parenteral nutrition. D. Restricting protein intake. Answer. A. Administering a diuretic as prescribed. Rationale: diuretics help to reduce fluid accumulation in patients with ascites. Encouraging a high-sodium diet and providing parenteral nutrition are not appropriate. Protein intake may need to be monitored but not necessarily restricted. Question 24. A patient with advanced liver disease is experiencing pruritus. What is the most appropriate nursing intervention to help relieve this symptom? A. Administering antihistamines as prescribed. B. Encouraging frequent bathing with hot water. C. Applying emollient creams to the skin. D. Restricting fluid intake. Answer. A. Administering antihistamines as prescribed. Rationale: antihistamines can help relieve pruritus in patients with liver disease. Frequent bathing with hot water can worsen the condition, while emollient creams and restricting fluid intake are not directly effective for pruritus management. Question 25. A patient with a colostomy is concerned about the odor from the stoma. Which of the following dietary modifications should the nurse recommend to minimize odor? A. Avoiding high-fiber foods. B. Including foods such as yogurt and parsley. C. Increasing intake of garlic and onions. D. Reducing fluid intake. Answer. B. Including foods such as yogurt and parsley. Rationale: foods like yogurt and parsley can help reduce colostomy odor. High-fiber foods, garlic, onions, and reduced fluid intake can increase odor and are not recommended. Question 26. A patient with advanced Alzheimer's disease is displaying signs of agitation and restlessness. Which of the following is the most appropriate initial nursing intervention? A. Administering antipsychotic medications. B. Providing a calm and structured environment. C. Using physical restraints to ensure safety. D. Encouraging the patient to engage in physical activity. Answer. B. Providing a calm and structured environment. Rationale: a calm and structured environment can help reduce agitation and restlessness in patients with Alzheimer's disease. Administering medications and using physical restraints should be considered only if other measures fail. Encouraging physical activity may not be appropriate in an agitated state. Question 27. A nurse is caring for a patient with newly diagnosed amyotrophic lateral sclerosis, ALS. Which of the following interventions should the nurse prioritize to maintain the patient's mobility and independence? A. Providing range of motion exercises. B. Administering muscle relaxants. C. Encouraging bed rest to conserve energy. D. Using assistive devices for ambulation. Answer: D. Using assistive devices for ambulation. Rationale: assistive devices help maintain mobility and independence in patients with ALS. Range of motion exercises are also important but secondary to using assistive devices. Administering muscle relaxants and encouraging bed rest are not priority interventions for maintaining mobility. Question 28. A patient with a recent below-the-knee amputation is experiencing phantom limb pain. Which of the following non-pharmacological interventions should the nurse recommend? A. Applying heat to the residual limb. B. Encouraging the use of a prosthetic limb. C. Providing mirror therapy. D. Restricting physical activity. Answer: C. Providing mirror therapy. Rationale: mirror therapy can help reduce phantom limb pain by creating a visual illusion of the missing limb. Applying heat and encouraging the use of a prosthetic limb are not directly effective for phantom limb pain. Restricting physical activity is not recommended. Question 29. A nurse is educating a patient with chronic obstructive pulmonary disease, COPD, about breathing exercises. Which of the following techniques should the nurse teach to help improve the patient's breathing? A. Deep breathing and coughing exercises. B. Pursed lip breathing. C. Diaphragmatic breathing. D. All of the above. Answer: D. All of the above. Rationale: deep breathing and coughing exercises, pursed lip breathing, and diaphragmatic breathing are all effective techniques to help improve breathing in patients with COPD. Each technique serves a specific purpose and can be used in combination for optimal results. Question 30. A patient with heart failure is being discharged home. Which of the following instructions should the nurse include in the discharge teaching to help manage the patient's condition? A. Limiting fluid intake to 2 liters per day. B. Avoiding all physical activity. C. Consuming a high-sodium diet. D. Monitoring daily weight. Answer: D. Monitoring daily weight. Rationale: monitoring daily weight helps detect fluid retention early in patients with heart failure. Limiting fluid intake and consuming a low-sodium diet are also important, but avoiding all physical activity is not recommended as moderate activity can be beneficial. Question 31. A nurse is caring for a patient with severe burns who requires nutritional support. Which of the following is the most appropriate method to ensure the patient receives adequate nutrition? A. Administering total parenteral nutrition, TPN. B. Providing a high-protein, high-calorie diet orally. C. Using a nasogastric tube for enteral feeding. D. Encouraging small, frequent meals. Answer: C. Using a nasogastric tube for enteral feeding. Rationale: enteral feeding via a nasogastric tube is often necessary to ensure adequate nutrition in patients with severe burns. TPN is used if enteral feeding is not possible. A high-protein, high-calorie diet and small, frequent meals are important but may not be sufficient for severe cases. Question 32. A patient with a history of stroke is experiencing dysphagia. Which of the following interventions should the nurse implement to reduce the risk of aspiration? A. Offering large bites of food. B. Providing thin liquids. C. Positioning the patient upright during meals. D. Encouraging rapid eating. Answer: C. Positioning the patient upright during meals. Rationale: positioning the patient upright during meals helps reduce the risk of aspiration. Offering small bites and thickened liquids, rather than large bites and thin liquids, is also recommended. Encouraging rapid eating increases the risk of aspiration. Question 33. A nurse is educating a patient with chronic pain on non-pharmacological pain management techniques. Which of the following should the nurse recommend? A. Engaging in regular physical activity. B. Practicing mindfulness and meditation. C. Using heat and cold therapy. D. All of the above. Answer: D. All of the above. Rationale: regular physical activity, mindfulness and meditation, and heat and cold therapy are all effective non-pharmacological pain management techniques. Each method can help reduce pain and improve the patient's quality of life. Question 34. A patient with advanced liver disease is experiencing hepatic encephalopathy. Which of the following interventions should the nurse prioritize? A. Administering lactulose as prescribed. B. Providing a high-protein diet. C. Encouraging physical activity. D. Restricting fluid intake. Answer: A. Administering lactulose as prescribed. Rationale: lactulose helps reduce ammonia levels in the blood, which is crucial for managing hepatic encephalopathy. A high-protein diet can worsen the condition, while encouraging physical activity and restricting fluid intake are not priority interventions. Question 35. A patient with chronic obstructive pulmonary disease, COPD, is experiencing increased mucus production. Which of the following interventions should the nurse implement to help manage the patient's symptoms? A. Encouraging fluid intake. B. Administering bronchodilators. C. Providing postural drainage. D. All of the above. Answer: D. All of the above. Rationale: encouraging fluid intake, administering bronchodilators, and providing postural drainage are all effective interventions for managing increased mucus production in patients with COPD. Each intervention addresses a different aspect of symptom management. Question 36. A patient with advanced cancer is experiencing intractable pain. Which of the following is the most appropriate nursing intervention to manage the patient's pain? A. Administering opioid analgesics as prescribed. B. Offering non-opioid pain relievers. C. Encouraging relaxation techniques. D. Providing physical therapy. Answer: A. Administering opioid analgesics as prescribed. Rationale: opioid analgesics are often necessary to manage intractable pain in patients with advanced cancer. Non-opioid pain relievers, relaxation techniques, and physical therapy can be used as adjuncts, but are not sufficient for severe pain. Question 37. A nurse is caring for a patient with chronic heart failure who is experiencing dyspnea. Which of the following interventions should the nurse prioritize to relieve the patient's symptoms? A. Encouraging deep breathing exercises. B. Administering a diuretic as prescribed. C. Providing supplemental oxygen. D. Positioning the patient in a high Fowler's position. Answer: D. Positioning the patient in a high Fowler's position. Rationale: positioning the patient in a high Fowler's position helps improve lung expansion and relieve dyspnea. Administering diuretics and providing supplemental oxygen are also important but should follow after positioning the patient. Question 38. A patient with multiple sclerosis, MS, is experiencing severe fatigue. Which of the following recommendations should the nurse provide to help manage the patient's fatigue? A. Taking frequent naps throughout the day. B. Engaging in regular physical exercise. C. Increasing daily caffeine intake. D. Limiting all physical activities. Answer. B. Engaging in regular physical exercise. Rationale: regular physical exercise can help manage fatigue in patients with MS by improving overall energy levels and physical conditioning. Taking frequent naps and limiting physical activities may lead to further deconditioning. Increasing caffeine intake is not a recommended strategy for managing fatigue in MS. Question 39. A nurse is educating a patient with chronic pain on non-pharmacological pain management techniques. Which of the following should the nurse recommend? A. Engaging in regular physical activity. B. Practicing mindfulness and meditation. C. Using heat and cold therapy. D. All of the above. Answer. D. All of the above. Rationale: regular physical activity, mindfulness and meditation, and heat and cold therapy are all effective non-pharmacological pain management techniques. Each method can help reduce pain and improve the patient's quality of life. Question 40. A patient with advanced Alzheimer's disease is displaying signs of agitation and restlessness. Which of the following is the most appropriate initial nursing intervention? A. Administering antipsychotic medications. B. Providing a calm and structured environment. C. Using physical restraints to ensure safety. D. Encouraging the patient to engage in physical activity. Answer. B. Providing a calm and structured environment. Rationale: a calm and structured environment can help reduce agitation and restlessness in patients with Alzheimer's disease. Administering medications and using physical restraints should be considered only if other measures fail. Encouraging physical activity may not be appropriate in an agitated state. Question 41. A patient with a history of chronic pain is admitted for an exacerbation of their condition. Which of the following non-pharmacological interventions should the nurse prioritize to help manage the patient's pain? A. Administering hot and cold therapy. B. Providing distraction techniques such as music therapy. C. Offering relaxation and guided imagery exercises. D. Ensuring a comfortable and quiet environment. Answer. C. Offering relaxation and guided imagery exercises. Rationale: relaxation and guided imagery exercises can help reduce pain perception and promote relaxation. Administering hot and cold therapy, providing distraction techniques, and ensuring a comfortable environment are also important, but guided imagery and relaxation have a more direct impact on pain management. Question 42. A patient with a history of chronic obstructive pulmonary disease, COPD, is experiencing increased mucus production. Which of the following interventions should the nurse implement to help manage the patient's symptoms? A. Encouraging fluid intake. B. Administering bronchodilators. C. Providing postural drainage. D. All of the above. Answer. D. All of the above. Rationale: encouraging fluid intake, administering bronchodilators, and providing postural drainage are all effective interventions for managing increased mucus production in patients with COPD. Each intervention addresses a different aspect of symptom management. Question 43. A nurse is caring for a patient with advanced liver disease who is experiencing hepatic encephalopathy. Which of the following interventions should the nurse prioritize? A. Administering lactulose as prescribed. B. Providing a high-protein diet. C. Encouraging physical activity. D. Restricting fluid intake. Answer. A. Administering lactulose as prescribed. Rationale: lactulose helps reduce ammonia levels in the blood, which is crucial for managing hepatic encephalopathy. A high-protein diet can worsen the condition, while encouraging physical activity and restricting fluid intake are not priority interventions. Question 44. A patient with chronic pain is prescribed a transcutaneous electrical nerve stimulation, TENS, unit. Which of the following instructions should the nurse provide regarding the use of the TENS unit? A. Apply the electrodes directly over the spine. B. Use the TENS unit continuously throughout the day. C. Adjust the intensity to a comfortable level. D. Apply heat while using the TENS unit. Answer. C. Adjust the intensity to a comfortable level. Rationale: the patient should adjust the intensity of the TENS unit to a comfortable level for effective pain relief. The electrodes should not be applied directly over the spine, and continuous use is not recommended. Heat should not be applied while using the TENS unit. Question 45. A 70-year-old patient with advanced dementia is admitted to the hospital for pneumonia. The patient is nonverbal and shows signs of discomfort when repositioned. Which of the following interventions is most appropriate to ensure the patient's comfort? A. Administering a PRN analgesic every hour. B. Turning and repositioning the patient every 2 hours. C. Placing the patient in restraints to prevent movement. D. Keeping the patient NPO to avoid aspiration. Answer. B. Turning and repositioning the patient every 2 hours. Rationale: repositioning the patient every 2 hours helps prevent pressure ulcers and reduces discomfort associated with prolonged immobility. PRN analgesics should be administered as needed, not routinely every hour. Restraints should be avoided unless absolutely necessary, and keeping the patient NPO without a clear reason is inappropriate. Question 46. A nurse is caring for a postoperative patient who reports severe pain at the incision site. The patient has a history of opioid addiction. Which intervention is most appropriate to manage the patient's pain while considering their history? A. Administering the highest dose of opioids allowed. B. Using a multimodal approach to pain management. C. Avoiding all opioid medications. D. Discharging the patient early to manage pain at home. Answer. B. Using a multimodal approach to pain management. Rationale: a multimodal approach to pain management includes the use of non-opioid medications, non-pharmacological methods, and the minimal necessary use of opioids. This approach helps manage pain effectively while considering the patient's history of opioid addiction. Question 47. A patient with chronic obstructive pulmonary disease, COPD, requires oxygen therapy. Which of the following should the nurse do to ensure the patient's comfort and safety while on oxygen therapy? A. Set the oxygen flow rate to 6 liters per minute. B. Use a Venturi mask to deliver oxygen. C. Ensure the patient uses an incentive spirometer every hour. D. Place the patient in a supine position. Answer. B. Use a Venturi mask to deliver oxygen. Rationale: a Venturi mask allows precise control of oxygen concentration, which is crucial for patients with COPD to avoid complications from excessive oxygen. Setting the flow rate too high can lead to CO2 retention. Using an incentive spirometer and positioning are supportive measures but do not directly address oxygen delivery. Question 48. A bedridden patient is at high risk for developing pressure ulcers. Which nursing intervention is most effective in preventing pressure ulcers? A. Massaging bony prominences every shift. B. Placing the patient on a low air loss mattress. C. Increasing fluid intake to 3 liters per day. D. Applying moist heat to pressure points. Answer. B. Placing the patient on a low air loss mattress. Rationale: a low air loss mattress helps reduce pressure on bony prominences and improves skin microclimate, effectively preventing pressure ulcers. Massaging bony prominences can damage tissues, and increasing fluid intake or applying moist heat does not directly prevent pressure ulcers. A diabetic patient is experiencing neuropathic pain in their feet. Which of the following interventions is most appropriate for managing this type of pain? A. Applying ice packs to the feet. B. Administering a tricyclic antidepressant. C. Encouraging the patient to walk frequently. D. Restricting fluid intake. Answer: B. Administering a tricyclic antidepressant. Rationale: tricyclic antidepressants are commonly used to manage neuropathic pain in diabetic patients. Ice packs are not effective for neuropathic pain, frequent walking may exacerbate pain, and fluid restriction is unrelated to pain management. Question 50. A patient with a history of congestive heart failure, CHF, reports feeling increasingly short of breath. What is the most appropriate initial nursing intervention? A. Administering a diuretic. B. Elevating the head of the bed. C. Encouraging deep breathing exercises. D. Restricting fluid intake. Answer: B. Elevating the head of the bed. Rationale: elevating the head of the bed helps alleviate shortness of breath by reducing pressure on the lungs and improving ventilation. Administering a diuretic requires a provider's order, and deep breathing exercises or fluid restriction may not address the immediate issue. Question 51. A patient is receiving palliative care for terminal cancer and reports persistent pain despite receiving their prescribed pain medication. Which of the following actions should the nurse take first? A. Increase the dosage of the current pain medication. B. Contact the healthcare provider to discuss alternative pain management options. C. Implement non-pharmacological pain relief measures. D. Withhold the next dose of pain medication to prevent overdose. Answer: B. Contact the healthcare provider to discuss alternative pain management options. Rationale: consulting the healthcare provider is necessary to review and potentially adjust the pain management plan. Increasing the dosage without a provider's order is inappropriate. Non-pharmacological measures should complement, not replace, medication, and withholding medication could lead to unnecessary pain. Question 52. A patient with a nasogastric (NG) tube complains of nausea and abdominal distension. Which of the following is the most appropriate nursing intervention? A. Administering an antiemetic medication. B. Flushing the NG tube with water. C. Checking the NG tube for patency and proper placement. D. Increasing the feed rate. Answer: C. Checking the NG tube for patency and proper placement. Rationale: ensuring the NG tube is patent and properly placed addresses potential causes of nausea and distension. Administering an antiemetic or flushing the tube might not be effective if the tube is obstructed or misplaced. Increasing the feed rate could worsen symptoms. Question 53. A nurse is preparing to administer a prescribed enema to a constipated patient. Which of the following steps is most important to ensure the patient's comfort and safety? A. Placing the patient in a prone position. B. Using cold tap water for the enema solution. C. Instructing the patient to retain the enema for at least 30 minutes. D. Lubricating the tip of the enema before insertion. Answer: D. Lubricating the tip of the enema before insertion. Rationale: lubricating the tip of the enema helps minimize discomfort and prevents injury during insertion. The patient should be placed in the left lateral position, the solution should be at body temperature, and the patient should retain the enema as long as comfortable, not necessarily 30 minutes. Question 54. A postoperative patient is at risk for developing deep vein thrombosis, DVT. Which of the following nursing interventions is most effective in preventing DVT? A. Encouraging bed rest. B. Applying intermittent pneumatic compression devices. C. Administering a high-protein diet. D. Limiting fluid intake. Answer. B. Applying intermittent pneumatic compression devices. Rationale: intermittent pneumatic compression devices promote venous return and reduce the risk of DVT. Encouraging bed rest, limiting fluid intake, and focusing on diet do not directly address DVT prevention. Question 55. A patient with advanced Parkinson's disease is experiencing difficulty swallowing. Which nursing intervention is most appropriate to reduce the risk of aspiration? A. Offering thin liquids frequently. B. Encouraging the patient to lie down after meals. C. Providing small, frequent meals with thickened liquids. D. Administering an antiemetic before meals. Answer. C. Providing small, frequent meals with thickened liquids. Rationale: thickened liquids and small, frequent meals help manage dysphagia and reduce the risk of aspiration. Thin liquids and lying down after meals increase aspiration risk, and antiemetics are not specifically indicated for dysphagia. Question 56. A nurse is caring for a patient with severe rheumatoid arthritis who is experiencing joint pain and stiffness. Which intervention is most appropriate to enhance the patient's comfort? A. Applying cold packs to the affected joints. B. Encouraging range of motion exercises during pain episodes. C. Administering a nonsteroidal anti-inflammatory drug, NSAID, as prescribed. D. Restricting physical activity. Answer. C. Administering a nonsteroidal anti-inflammatory drug, NSAID, as prescribed. Rationale: NSAIDs help reduce inflammation and pain in patients with rheumatoid arthritis. Cold packs are more appropriate for acute injuries, and restricting physical activity can lead to joint stiffness. Range of motion exercises should be performed when the patient is not in severe pain. Question 57. A patient with a newly placed colostomy is anxious about caring for the stoma. Which nursing intervention is most effective in addressing the patient's anxiety and promoting self-care? A. Providing written instructions only. B. Demonstrating the colostomy care procedure and encouraging practice. C. Reassuring the patient that the stoma will heal without any care. D. Performing all colostomy care for the patient. Answer. B. Demonstrating the colostomy care procedure and encouraging practice. Rationale: demonstrating the procedure and allowing the patient to practice builds confidence and reduces anxiety. Written instructions alone are insufficient, and performing all care does not promote independence. Reassuring the patient without education is not helpful. Question 58. A nurse is caring for a patient with chronic kidney disease, CKD, who is experiencing pruritus. Which nursing intervention is most appropriate to manage the patient's pruritus? A. Increasing the patient's fluid intake. B. Applying moisturizing lotion to the skin. C. Encouraging hot showers. D. Administering a diuretic. Answer. B. Applying moisturizing lotion to the skin. Rationale: moisturizing lotion helps alleviate pruritus associated with CKD by hydrating the skin. Increasing fluid intake and hot showers can exacerbate skin dryness, and diuretics are not indicated for pruritus. Question 59. A patient with multiple sclerosis, MS, is experiencing muscle spasms. Which of the following interventions is most appropriate to manage muscle spasms in this patient? A. Applying cold packs to the affected muscles. B. Encouraging vigorous exercise. C. Administering a muscle relaxant as prescribed. D. Providing a high-protein diet. Answer. C. Administering a muscle relaxant as prescribed. Rationale: muscle relaxants help reduce muscle spasms in patients with MS. Cold packs and vigorous exercise may worsen spasms, and diet modifications do not directly address muscle spasms. Question 60. A patient with a history of stroke is experiencing dysphagia. Which intervention is most appropriate to reduce the risk of aspiration during meals? A. Offering large, frequent meals. B. Providing thin liquids with meals. C. Instructing the patient to tuck their chin while swallowing. D. Encouraging the patient to eat quickly. Answer: C. Instructing the patient to tuck their chin while swallowing. Rationale: tucking the chin while swallowing helps prevent aspiration by closing the airway. Large meals, thin liquids, and eating quickly increase aspiration risk. Question 61. A nurse is caring for a patient with a newly inserted urinary catheter. Which intervention is most important to prevent catheter-associated urinary tract infections, CAUTI? A. Irrigating the catheter daily. B. Keeping the drainage bag above the level of the bladder. C. Ensuring the catheter tubing is not kinked. D. Changing the catheter every 72 hours. Answer: C. Ensuring the catheter tubing is not kinked. Rationale: preventing kinks in the catheter tubing ensures proper urine drainage and reduces CAUTI risk. Irrigation, improper positioning of the drainage bag, and frequent catheter changes are not recommended practices for CAUTI prevention. Question 62. A patient with chronic pain is prescribed a patient-controlled analgesia, PCA, pump. Which nursing action is most appropriate to ensure the patient's comfort and safety? A. Programming the PCA pump according to the prescription. B. Allowing family members to press the PCA button for the patient. C. Setting a maximum dose limit higher than prescribed. D. Encouraging the patient to use the PCA pump only at bedtime. Answer: A. Programming the PCA pump according to the prescription. Rationale: proper programming of the PCA pump ensures safe and effective pain management. Only the patient should press the PCA button, the dose limit should follow the prescription, and PCA use should be as needed, not restricted to bedtime. Question 63. A patient with terminal cancer expresses a desire to spend their final days at home. Which nursing intervention is most appropriate to support the patient's comfort and wishes? A. Discharging the patient without a care plan. B. Coordinating with a palliative care team for home hospice services. C. Advising the patient to remain in the hospital for better care. D. Limiting family visits to reduce patient stress. Answer: B. Coordinating with a palliative care team for home hospice services. Rationale: home hospice services support the patient's comfort and wishes by providing palliative care at home. Discharging without a plan, advising against home care, and limiting family visits are not supportive actions. Question 64. A nurse is caring for a patient with amyotrophic lateral sclerosis, ALS, who has difficulty communicating. Which intervention is most appropriate to enhance the patient's ability to communicate? A. Providing a whiteboard and marker. B. Encouraging verbal communication only. C. Restricting visitors to reduce communication strain. D. Using medical jargon to communicate. Answer: A. Providing a whiteboard and marker. Rationale: a whiteboard and marker facilitate nonverbal communication for a patient with ALS. Encouraging verbal communication may not be feasible, and restricting visitors or using medical jargon does not enhance communication. Question 65. A patient with end-stage renal disease, ESRD, is receiving hemodialysis and complains of muscle cramps during the procedure. Which nursing intervention is most appropriate to address this complaint? A. Administering an analgesic before dialysis. B. Increasing the rate of dialysis. C. Assessing the patient's electrolyte levels and adjusting the dialysis prescription accordingly. D. Applying ice packs to the cramping muscles. Answer. C. Assessing the patient's electrolyte levels and adjusting the dialysis prescription accordingly. Rationale: muscle cramps during hemodialysis can be due to electrolyte imbalances, so adjusting the dialysis prescription based on assessment is appropriate. Analgesics, increasing the dialysis rate, and ice packs do not address the underlying cause. Question 66. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is receiving continuous oxygen therapy. The patient complains of dry nasal passages and throat. Which intervention is most appropriate to alleviate this discomfort? A. Increasing the oxygen flow rate. B. Using a humidifier with the oxygen delivery system. C. Encouraging the patient to drink carbonated beverages. D. Applying petroleum jelly inside the nostrils. Answer. B. Using a humidifier with the oxygen delivery system. Rationale: a humidifier adds moisture to the oxygen, alleviating dryness. Increasing the flow rate and carbonated beverages are not appropriate, and petroleum jelly inside the nostrils can pose a fire hazard with oxygen use. Question 67. A patient with advanced cirrhosis is experiencing pruritus. Which intervention is most appropriate to manage the patient's discomfort? A. Administering a bile acid sequestrant as prescribed. B. Increasing sun exposure. C. Encouraging hot baths. D. Applying ice packs to the skin. Answer. A. Administering a bile acid sequestrant as prescribed. Rationale: bile acid sequestrants help manage pruritus associated with liver disease by reducing bile salts in the skin. Increasing sun exposure, hot baths, and ice packs do not effectively manage pruritus in cirrhosis patients. Question 68. A patient with a spinal cord injury at T6 is at risk for autonomic dysreflexia. Which nursing intervention is most appropriate to prevent this condition? A. Administering antihypertensive medication daily. B. Ensuring the bladder is emptied regularly. C. Keeping the patient in a supine position. D. Restricting fluid intake. Answer. B. Ensuring the bladder is emptied regularly. Rationale: autonomic dysreflexia can be triggered by a full bladder, so regular emptying helps prevent it. Antihypertensive medications are not preventative, the supine position can exacerbate the condition, and fluid restriction is not appropriate. Question 68. A nurse is teaching a patient with congestive heart failure, CHF, about fluid restriction. Which instruction is most appropriate for the patient? A. Drink at least 3 liters of water per day. B. Use a small cup to help monitor fluid intake. C. Increase salt intake to balance fluids. D. Avoid all beverages except water. Answer. B. Use a small cup to help monitor fluid intake. Rationale: using a small cup helps the patient monitor and control fluid intake effectively. Drinking excessive water and increasing salt intake are contraindicated in CHF, and avoiding all beverages is impractical. Question 70. A patient with Alzheimer's disease is wandering and agitated. Which nursing intervention is most appropriate to ensure the patient's safety and comfort? A. Applying physical restraints. B. Providing a calm and structured environment. C. Administering a sedative. D. Isolating the patient in a room. Answer. B. Providing a calm and structured environment. Rationale: a calm and structured environment helps reduce agitation and wandering in patients with Alzheimer's disease. Physical restraints, sedatives, and isolation are not first-line interventions and can increase distress. Question 71. A nurse is caring for a patient with a tracheostomy who is experiencing thick mucus secretions. Which intervention is most appropriate to manage this issue? A. Suctioning the tracheostomy every hour. B. Increasing the patient's fluid intake. C. Applying warm compresses to the chest. D. Restricting the patient's fluid intake. Answer: B. Increasing the patient's fluid intake. Rationale: increasing fluid intake helps thin mucus secretions, making them easier to manage. Routine suctioning should be as needed, not hourly, and warm compresses and fluid restriction do not address the issue directly. Question 72. A patient with multiple sclerosis (MS) reports experiencing fatigue. Which nursing intervention is most appropriate to help manage the patient's fatigue? A. Encouraging the patient to take frequent rest periods. B. Advising the patient to avoid all physical activity. C. Administering a stimulant medication. D. Restricting the patient's fluid intake. Answer: A. Encouraging the patient to take frequent rest periods. Rationale: frequent rest periods help manage fatigue in patients with MS. Avoiding all physical activity can lead to deconditioning, stimulant medications are not typically first line, and fluid restriction is unrelated. Question 73. A patient with chronic obstructive pulmonary disease, COPD, is experiencing dyspnea. Which position is most appropriate to help alleviate the patient's breathing difficulty? A. Supine position. B. High Fowler's position. C. Trendelenburg position. D. Lithotomy position. Answer: B. High Fowler's position. Rationale: high Fowler's position, sitting upright, helps improve lung expansion and reduces dyspnea in patients with COPD. Supine, Trendelenburg, and lithotomy positions are not appropriate for alleviating dyspnea. Question 74. A nurse is caring for a patient with a stage 3 pressure ulcer. Which intervention is most appropriate to promote healing of the ulcer? A. Keeping the wound dry and exposed to air. B. Applying a moist wound dressing. C. Massaging the area around the ulcer. D. Using alcohol-based cleansers on the wound. Answer: B. Applying a moist wound dressing. Rationale: a moist wound dressing promotes healing by maintaining an optimal environment. Keeping the wound dry, massaging the area, and using alcohol-based cleansers can delay healing or cause further damage. Question 75. A patient with end-stage renal disease, ESRD, is on hemodialysis and reports feeling lightheaded during the procedure. What is the most appropriate nursing action? A. Increasing the dialysis rate. B. Administering a bolus of normal saline. C. Placing the patient in a supine position. D. Restricting fluid intake before dialysis. Answer: B. Administering a bolus of normal saline. Rationale: a bolus of normal saline helps address lightheadedness caused by fluid shifts during hemodialysis. Increasing the dialysis rate, changing positions, and fluid restriction do not directly address the immediate symptom.